today and for the next several weeks is the reconciliation bill. Again, the reconciliation bill is certainly a very reconciliation certainly is a very complicated process. Certainly has been discussed a lot in the media, but what it boils down to is essentially a method by which Congress is trying to add additional improvements to the Senate bill. So the House has passed their version of the reconciliation bill last night, and the portions of the reconciliation bill that apply most to our communities surround affordability. Within the reconciliation bill right now, the affordability credits for the low income are improved, and we're pleased about that. However, the affordability credits that are provided to that population of newly arrived immigrants subject to the 5-year bar, we believe are insufficient. We're very concerned that the portion of that population in the lowest income brackets, even after receiving the affordability credits, will simply still not be able to purchase health insurance coverage. And we are fighting and pushing on this issue to ensure that there is greater affordability with respect to this population. Another major area of concern for our communities is the treatment of the U.S. territories. These include American Samoa, Guam, and Northern Mariana Islands, amongst others. The positive side of the reconciliation bill is that it provides these territories with the option to create their own their own exchanges, and it provides them with $1 billion to create the exchanges and to provide affordability credits through those exchanges, whereas the Senate bill currently does not allow for that. So we're very happy with that improvement. Additionally, the reconciliation bill provides an extra $2 billion on top of the Senate bill in terms of increasing the Medicaid cap on the territories for Medicaid funding. While we're pleased that there are improvements in terms of increases in funding for the territories in Medicaid, we're still looking for parity with the states. And currently, even with improvements, there is not the treatment of the territories in Medicaid and in health insurance reforms are not equitable with the states. And so that is a fight that we will continue to have. Finally, of concern to our communities is the safety net of this nation, which are the community health centers. Within the reconciliation bill, they provide $11 billion between 2011 and 2015 for the support of community health centers. So that is something that we are pleased with. So these are some of the fixes and improvements that the reconciliation bill makes to the Senate bill. As we can see, our issues are still out there. They are still issues that we have to continue pushing for in the coming months and years. Also, within the next several weeks, as I mentioned before, the reconciliation bill is being moved over to the Senate, and we expect that to finish up around post-Easter, again, because there are procedural hurdles that that reconciliation still needs to overcome before it is passed in the Senate. And we also expect significant changes possibly to happen in the Senate when it comes to the reconciliation bill. So we will definitely keep everyone posted as to what those changes are and how that impacts our communities. So I want to again reiterate that we are at a historic moment. There are major improvements coming our way in terms of improvements to our healthcare system, and it is a moment that we can stop and embrace, but not for too long. We definitely are, again, really concerned about the immigrant population in this nation, and so much more can be done in terms of improving affordability for the low income and for immigrants in this nation. So that is definitely our work ahead, and I want to thank you for listening to a lot of procedural issues around healthcare reform and for your interest in our communities and advancing the health of our communities. If you have any questions, please feel free to email me at adong@apiahf.org. Thank you so much.